This patient was referred to me for endodontic treatment of tooth number 14. Her dentist had already started the root canal, but after 1 hour and 20 minutes of working on this tooth, hour and 20 minutes of working on this tooth, the dentist had told the patient that there were blockages and could not do the root canal and referred the patient out. I don't like these types of situations because I feel that it's not fair to the patient, and because the dentist should have known his or her limitations, of course. And now I'm not sure what I'm getting myself into, because if this was a tooth like this, untouched, unharmed, then I knew exactly what I was getting myself into. Now, with this tooth, I have no idea what I'm getting myself into. Yep. Bye.
Bye, doctor.
See you tomorrow.
See you tomorrow.
Good job. So I have no clue, no idea what I'm getting myself into. I don't know if I can bypass the blockages. I'm sure there are ledges and all kinds of other stuff that could have happened during the endodontic treatment that the dentist already started. Anyways, I discussed all of this with the patient and went over the extraction option with the patient also. Patient is younger. She said, do your best. Let's see if we can save this tooth. And I said, okay, and that's what we did today. As you can see, periapical lucency there. So I get in, there was minimal cavity left. The patient had lost her temporary crown. According to the patient claimed that the temporary crown, she went and saw the dentist on Friday. The dentist said they couldn't do the root canal. They temporized the tooth, put a temporary crown on the tooth. That was Friday. Patient says Saturday she lost the temporary crown. So this temporary crown only lasted 1 day. Anyways, minimal cavity remaining. I removed a huge cotton pellet from within the pulp chamber. The dentist had found MB1, distal buccal and palatal, and had blocked and ledged all three of them. The canal that the dentist hadn't found was the MB2, and I was able to locate and instrument the MB2 to its working length within 7 minutes. But the canals that this dentist had found were ledged and blocked, and I spent about 45 minutes on those 3 canals. Anyways, I was able to get a very good result. Take a look. So this is one angulation. You can see the MB1 and the MB2. There's a very nice apical curvature as well. Look at the palatal canal. It bifurcates apically. And that's the lesion. That's the periapical radiolucency you see here. All right, so here you can see the bifurcation and a nice lateral. So that's the bifurcation right there, and maybe trifurcation. 1, 2, 3, and then a nice lateral. Look at all of this anatomy that's happening in the MB1 and MB2 area, in the apical area of the MB1 and MB2 canals. And that's the distal buccal canal, as you can see. Again, everything went beautifully. I'm optimistic about this tooth, but I just wish that I had the tooth when it was unmolested, unharmed, and untouched. But still, we were able to achieve a high level of success with this tooth, because I was able to, as I said, bypass all the blockages and ledges and be able to regain patency in all 4 canals. We temporized the tooth and referred the patient back to her dentist for the permanent restoration.